Hello, I'm Dr. Janis Gasch. I'm the founding director of Arizona Hearing Specialists, and I'm proud to report that we are celebrating over 30 years of service to Southern Arizona. Our goal is to help you hear your best and help you live your best. What I'd like to talk about for a few minutes is the process that you will go through when you first come to our office. The first thing that we will do is an in-depth medical and hearing health interview to take a look at what your history has been in terms of noise exposure, family history, how you feel that you're hearing on a daily basis, and we'll also take a look at the situations that you feel that you would like to hear better in. An important part of this interview is also involving your companion in the process, because when there's a hearing loss in the family, it really affects the communication of the whole family. The second thing we'll do after we finish with the interview process is we will do an examination of your ears. We want to make sure that there is no wax obstructing your ear canals and that your eardrums look healthy. And we also want to make sure that there's nothing obstructing our ability to test your hearing. The third part of the test involves the actual examination, and we will do a series of tests that will tell us if you have a hearing loss, how much hearing loss, what kind of a hearing loss, and will help us work with you to determine solutions to that hearing loss. We will also do a test to measure the ability of your eardrum to respond to air and make sure that your eardrums are moving normally. We will then get to the fourth part of your evaluation process, and that is explaining the test results to you and talking about treatment solutions. We all feel that it's very important that you're able to visually look at the results of your evaluation, and we make sure that you understand where the hearing loss is occurring, in which frequencies, and at what levels, so that it can relate back to what you are hearing or not hearing on a daily basis. And once we have explained the test results to you and your companion, hopefully you will be able to bring a companion with you to your first visit. We will then talk to you about treatment solutions. Those solutions might include amplification, hearing aids. It might include assistive listening devices for listening to the TV or the telephone. And it might also include just learning ways to pay attention and rearrange your listening environments to best suit the environment and your hearing needs. Often it includes a combination of all of those. One of the other things that we feel very strongly about is after we see you, we will send a complete report back to your physician so that he or she will know exactly what your hearing loss is like and what recommendations we have made for you.